c'est une école de Papa Poudra, c'est une école qu'on ne trouvera jamais ici au Bas-Congo, à la Sainte Égalité.
This is a human story that has developed and grown over the last 10 years in the heart of Africa, in the Democratic Republic of Congo. It is the second largest country on this continent, 76.9 times larger than Belgium, its former colonizers. It is the story of how Tina Buchan, Gilles Marceau and the Buchan International Fund, in partnership with the Susila Dharma International Network, have touched the lives of hundreds of thousands of people, providing access to sustainable, quality healthcare and transforming communities. Today, around 80 million people live here, making it the fourth most populous country in Africa. Population growth is among the highest in the world at almost 3%, with each woman giving birth to 6.3 children on average. In 2016, 41.2% of the population was under 15 years old. Such rapid population growth, coupled with widespread poverty and lack of basic services and infrastructure, means this country presents one of the most challenging development contexts in the world. Thankfully, there are people within and outside the Congo who are working to counteract this dramatic situation, bringing their skills, resources, and perseverance to providing services that bring hope to many people. Our story is about the creation of a network of health and hospital centres that were built by the people of the Congo with the help of the Susila Dharma International Network and the Buchan International Fund. We start our journey in the southern suburb of the capital, Kinshasa, in Lemba Imbu, where, despite being close to a major city, poor roads and high cost of transport made it impossible for people to get the medical attention they so badly needed.
Ici, nous sommes à Lemba Imbu précisément.
Here we are at Lemba Imbu, a rural community where people live from their agricultural activity and by raising animals for consumption, mainly chicken and pigs. The living conditions were really deplorable, so we really needed to consider what activities could help the development of the community. It was agreed that we should implant a community health centre to provide a good quality of health care to the community.
The Lemba Imbu Community Health Centre grew out of the Susila Dharma School of Lemba Imbu. The school had identified the urgent need to build a school infirmary to address the health needs of its students, but there were also needs at the level of the whole community. So we took this opportunity to pilot our model of a community health centre based on the principles of autonomy and sustainability. That is, once the basic infrastructure and equipment is put in place, we don't need to keep asking for donor support to pay the bills, to buy routine supplies. The centre carries itself.
This is the delivery room. All pregnant women deliver here. And then the mother is moved to the postpartum room, where she is under observation for 48 hours to make sure there are no complications. If there are no complications, she is moved to this recovery room. So all women who give birth without complications spend a few days in the maternity section to rest and recover.
The first Centre de Santé Communautaire was opened in Lemba Imbu in 2010. Some 5,000 patients are treated in this 32-bed facility each year, provided with pre- and antenatal services for mothers and babies, vaccination programs, minor surgeries, health education for families, and a range of preventative and curative services for the surrounding population. A key focus is also on involving the local population through the participation of elected representatives on the management team of the centre, through working with the local health committee and Ministry of Health, and through the management of their own health mutual association. Of the 15 employees, half are from the community next door, as is this young male nurse.
My name is Grace Basunga Luzolo. I am head nurse at the Lemba Imbu Community Health Center since 2019. I wake up early in the morning, I prepare my bag, I make sure I have all my documents, my mask and supplies. We are very lucky that we never lack for any supplies at our center, because many centers don't have the materials that they need. Here we receive all kinds of patients, but we are mostly focused on pediatric care. I hope we will soon be able to finish the work on our new pediatric ward.
What pushed to initiate this project? I'm a teacher and I have lived in this community for 26 years. I can say that the socio-economic problems here have various causes. In the area of education, there were very few schools. In the area of healthcare, there was nothing. No health center that could take care of the community. That is why we really wanted to see a health center develop in this community and gradually to add different services, like specialized pediatric care that were missing. Education and health care are the two most basic needed services upon which the community can develop itself.
We leave Lemba Imbu for the rural village of Antoko in central Congo province, where the hospital centre of Antoko was opened in 2013. This rural centre services a large area covering some 200 square kilometres. With core salaries covered by the Ministry of Health, the centre is able to keep the cost of care for the community to a minimum. Local entrepreneurs also support the operations of the centre by paying for a monthly healthcare plan for their employees.
Here, there was a state-run health center that was basically falling down, and together with the community, we proposed to build a new health center together. Here, our model evolved towards working directly in partnership with the local health authorities. We provided the infrastructure and equipment for the center, but the staff was provided by the state, which means that the staff benefits from the technical supervision from both the NGO and the Ministry of Health, as well as their state salary. This lowers the cost of health service to the patient.
If this centre is here, it is because of the very high child mortality, mainly for children 0 to 5 years of age, and especially for the newborns, due to the fact that there was a very bad quality of care, a lack of access for rural families, no equipment or medicines. That was why Susila Dharma came to build this jewel of a health centre that you see here today. Since Susila Dharma built this centre, the community is getting the care it needs and health indicators have really improved.
Et ce qui est vrai, les choses se sont améliorées.
In both Lemba Imbu and Antoko, SDIA and SD Congo, in collaboration with the Buchan International Fund, are working on a new innovation to develop community learning centres alongside the existing healthcare centres. This will create a one-stop shop for rural women, girls, men and boys where they can access healthcare, childcare and learning services. The Community Learning Centre at Antoko is being set up to provide much-needed literacy and skills training to local women and youth who never went to school or were forced to abandon their studies at an early age due to poverty, teenage pregnancy or early marriage. With the skills needed to generate an income, women and girls will be better able to look after their families, bringing them closer to breaking the cycle of poverty.
The difficulty for most of us girls is that we have to stop our studies very young. We drop out of school at a very early age. Many become pregnant by a young man who is not able to take responsibility, and sometimes he too doesn't even have the means to support a family. And this makes life very difficult for the young girl herself, her child, and her parents. Building a learning center here in the village will solve a lot of problems, not only for me, but also for many other girls and women in the village who never got an education, and even the boys who have nothing else to do but run after girls. We really work to create employment and incomes for the girls like me who never got a chance to learn.
Here we are in one of the production units for interlocking bricks that Susila Dharma Congo uses to produce the bricks needed for its constructions, such as health centers and schools. The bricks you see behind me enable us to build stronger and cheaper. They require less water and less cement than other bricks, and are mixed with inorganic soil to make a cost-effective building material with locally available materials. Brickmaking, construction and other industries, such as the maintenance and repair of solar panels, are some of the training areas that we are introducing in our community learning center here at Antoko to help women and girls become more financially independent in their daily lives. We are able to use our own resources, our bricks and other materials, to teach them about construction, as well as to build the learning centers themselves.
From Antoko, we travel to the site of our third community health center at Nkandu on the outskirts of the town of Nkisi in central Congo province. Here we meet a young man, Landry Nsuka, who dreamed of one day becoming a doctor and helping to care for his community. Now he will have a job practicing medicine and be able to realize his dream.
My name is Landry Nsuka. I am a doctor. I did my studies at the University of the Congo in central Congo. During the course of my studies, like many others, I knew a lot of financial difficulties. It was thanks to the NGO Susila Dharma that I was able to obtain my medical diploma. After I graduated, it was impossible for me to pay the accreditation with the medical order. And once again, thanks to Susila Dharma, I was able to get my registration number as a doctor.
I would also like to thank the Tina Buchan International Fund, because thanks to them,
we have this wonderful health center that you can see behind me, built according to international standards.
The objective of this program to create a network of community health centers is to ensure that each center becomes sustainable and self-sufficient. This means that while we benefit from the support of the partners to build the center, we don't want this support to go on forever. So we encourage all people to join the Health Mutual Association so that the community can share the risk and benefits of health coverage and increase their purchasing power as a group to negotiate for health services they want most.
Today, thanks to the efforts of SD Congo, SDIA and the Buchan International Fund, 4 local health mutual associations have been created, each advocating and negotiating for quality health services on behalf of their 15,500 members. SDIA and SD Congo are strongly aligned with other organizations advocating that the government of the DRC introduce universal health coverage for its citizens. It is most likely to come through a cost-sharing arrangement and partnership between the government and a duly constituted and regulated network of health mutual associations.
My name is Kapesa, and I am a resident and the chairman of the Health Committee at Nkandu 3rd. I act as the bridge between the community and the Community Health Centre. Before this centre was built here, we were experiencing indescribable difficulties. We had been ravaged by many epidemics, for example measles and polio, which had ravaged the Central Congo province. This was the first centre to have immediately detected these diseases, and this saved a lot of lives and limbs. The Nkandu 3rd Community Health Programme, with its network of health volunteers, has been raising awareness, and we quickly detected this measles epidemic in the neighbourhood, and we were able to stamp it out. I insist, if you can get close, tell them we say big thanks to them.
The last leg of our journey takes us to the town of Quilungongo. Where Susila Dharma was requested to step in and help another community in urgent need of adequate healthcare facilities. The result was the Mother-Child Hospital Centre of Quilungongo, built with funding from the German government's BMZ, the Buchan International Fund and the Susila Dharma International Network.
Before, the community faced a lot of problems related to healthcare. We were being treated in a rundown structure that had nothing to do with any health standards. Since then, the community has seen the quality of the center built by Susila Dharma. We really took this on as our own center, and we are so happy with the services that are provided. Well, we had a challenge with the site because of the river, the Sika River. We really need to say thank you, thank you, thank you, because this little river caused a lot of problems to the community who lived on one side, but their fields were on the other. When it rained, the community could not get across. Thanks to this project, the community can easily cross and have access to the health center and their fields.
Can't tell about nothing, Et en ce qui concerne les femmes enceintes, il y avait des femmes
Regarding
enceintes
pregnant women, there are many who would die trying to access care, especially those who need surgery or a caesarean section. But since this hospital is here, we have seen an important decrease in the maternity mortality rate, because here at the Mother-Child Hospital Centre, we are equipped to carry out any needed surgical intervention on site.
The Mother-Child Hospital Centre is equipped with life-saving technologies and can dramatically reduce maternal and infant mortality. This is the quality of care that would be hoped for by so many other communities in the DRC. Susila Dharma believes that working together with donors like Tina Buchan and the Buchan International Fund, we have a health and learning centre model that can be replicated and scaled up to sustainably help thousands of other communities.
Nous avons une moyenne de 50 échographies par mois. La plupart sont des échographies qui concernent.
We do an average of 50 ultrasounds a month. Most are for pregnant women. As you know, the World Health Organization recommends at least 3 ultrasounds during the pregnancy to ensure that the fetus is developing properly and is in the position prior to delivery. We also carry out abdominal and prostate ultrasounds.
Le nouveau bâtiment aussi des pédiatriques sera construit.
The hospital centre is receiving so many patients, we are already in an extension phase. We are building a pediatric unit. Here is the laboratory, and there will be the blood bank. All of these facilities, the new laboratory and radiology, will allow us doctors and those of us doing medical imaging to really provide excellent diagnostic services, and for so many children dying of anemia, the blood bank will allow us to intervene early so as to save lives.
Whether at the level of the community or of health workers, we were able to train many people, and this results in a better health system for all. As local health authorities, we are really behind this NGO. We can walk together with them. All the resources that they have made available to us, we manage them as good custodians for the benefit of the population of Quilungongo.
Pour que la population de Quilungongo puisse en bénéficier. Ces projets, c'est comme un enfant.
This project is like a child that we conceived together, that we brought together into the world, and today we are seeing it grow to maturity, and it is growing very fast. Really, we want to thank all of those who have helped us to achieve so much. Bravo to them. Bravo to Susila Dharma. Bravo to BMZ. Bravo to the Buchan Foundation and to all the partners. Bravo.
Et bravo à tous les partenaires.
Congo à la santé égalité.
Wow. Hey, c'est vrai.